Welcome to Radiance and Rosé, the podcast about anti-aging, beauty, and lifestyle.
Hey guys, welcome back to another episode of Radiance and Rosé with Joy
and Aaliyah. Check us out on IG, Podbean, iTunes Podcasts, and YouTube. In the studio today, we have Nicole DeVincentis, founder of Glowtox NYC, an aesthetic dermatology practice in NYC. Nicole is a board-certified PA who specializes in aesthetic dermatology. You look flawless. We need to know it all.
All of it. I need to know all of it.
Everything.
Like, literally, so the name of her company is Glowtox, and she's literally glowing.
Glowing.
I mean, like,
she's Radiance, and we have Rosé.
All right, no, seriously. Is that makeup, or is that just your skin?
That is a commitment to a regimen.
Let's get into that. That's on the agenda. We want to know, like, your chosen daily regimen.
Yeah,
what do we need to be doing? I mean, we're going to talk about sort of the deeper things that you do and kind of, but not all of us have the, access to some of that stuff. And so, we want to talk about what we can do on a day to day that's going to move the needle.
Sure, of course. So, I am not fickle, and I think that's really important with skincare.
You're not?
No, and I think, the cosmeceutical industry survives on that because, like, most of my friends are like, ooh, every week I got a new cream, I got a new serum, I got a new...
Right.
I am not fickle.
Well, we're definitely...
I'm the most fickle.
We're guilty of that. Like, so we definitely... We're not loyalists.
Yeah. So, I mean, when you find something that works good, you want to let it work, and most of those things take a lot of time. So, retinol at night is necessary unless you're trying to get pregnant. Antioxidants, plural, if possible, as much as possible. I use
within serums.
I like serum for that. I use a serum, a CE and ferulic acid in the morning. The ferulic acid is it helps the C and the E work better, but they're all independent antioxidants on their own, but really good if you can do all three. I use SkinCeuticals.
Mm-hmm. You love SkinCeuticals.
Love.
I've been hearing so much about the CE ferulic, and I feel like
It's amazing, other than it smells like bacon.
Oh.
For 5 minutes.
Okay.
But then it goes away.
I'm sorry, can I ask one question, though? You say retinol at night. Is there a specific retinoid? Because I know, retinol has different forms, and some of these serums is it like specifically tretinoin, or is it something else?
I think that is really something that the patient themselves has to, do a little trial and error for.
Okay.
The SkinCeuticals one I happen to use in the summer, which is the low dose one, the 0.5.
Right. Okay.
Because I'm oily. In the winter, I go back to, I actually use Dr. Y Secrets.
Right.
But tretinoin based though.
Mm-hmm.
So there's a few good ones out there, but you just want to make sure it's a medical grade line. So we don't want to go into like CVS trying to buy a retinol, which they have,
No, I've seen like ROC, right? They have like that ROC brand in CVS, right?
Yeah, and the only reason is I'm not knocking that. It's not that you have to spend a lot of money. It's just that that's not regulated. So if you're buying a medical grade line that can only be sold by a doctor's office, they are like prescriptions. Rather than going into an over-the-counter situation, they don't have to list how much they put in.
And then the preservatives, right? Like, how do you maintain, like, I know a lot of sometimes like these products have expiration dates, right? Like if they're in the CVS and they're sitting there for 3 years, are they still as effective? I mean,
right. That's also very true of online ordering, right? Because you don't know where these things are coming from. It's like I went to my storage unit the other day and the guy opened up the door and I was like, oh my God. He had like beauty products in there, they're endless. That's where they're staying.
So just so the listener is like paying attention, like when you order like products off of Amazon, say for instance, right? And it might be the product, but it could be 10 years old. You have no idea. Right. There's no way of knowing whether those products are actually expired.
I never order any skincare off of Amazon.
Right.
I order everything else of my life off Amazon, but just not skincare.
No, and I have really good friends who are really smart who order beauty products on Amazon because it's ease of access, right? It's just easy.
It is.
But again, you don't know if it's actually...
Yeah.
Exactly.
And if you read the reviews, actually, you should check out because I read all the reviews and it's like, I don't think that this was the exact form. Like people really, I think there's some fraudulent
I've seen
things
that also.
happening.
It's like perfume. It's like all of that stuff on there.
Yeah. Okay, so retinol, antioxidants, serums. Okay.
And a physical sunscreen. So I use zinc, physical zinc sunscreen. All day, every day.
Okay,
It's my
so you
moisturizer.
Okay,
reapply.
so not an SPF.
No. It's just my moisturizer. It's like part of my daily routine. It doesn't matter if I'm not leaving the house. It just should happen.
Wow.
And then I have a moisturizer from SkinCeuticals. This is a new product that they have. That's like a moisturizer with SPF 30. That is amazing. It comes in a really big squeezy tube. And, you just put it on your hands, your arms,
Oh, it's
chest.
full body.
Yeah, for when you're walking
Oh.
around. And you don't smell like,
That's a good idea.
you're at the beach. Yeah.
Right.
So, but those 3 things for the face are critically important, and they are important to do for a long time. Like, it's not going to change your life doing it for 2 weeks.
Right.
And how do you feel about peptides? Do they have a place in this regimen?
Oh, absolutely. I think peptides are amazing. I use a Nectafirm, which is peptide for neck and décolleté. I think peptides are wonderful. I mean, they definitely work. They keep skin barrier. They keep moisture. They keep the integrity of the skin. Very important. Just,
So that's your daily regimen. What about at night? Do you do anything special at night?
just eye serum with a retinol and the regular retinol for... Retinol is only at night usually because it's not stable in the sun.
Mm-hmm. So it's okay to put retinol under your eye.
If it's in an eye cream
I was
and you can tolerate it,
I was told that the basic tretinoin that you can buy at, your dermatologist, like just the pure tretinoin,
the prescription.
the prescription one, my old derm put it all the way up to her eyes. She told me.
Yeah, if you can get there, because it's not an elegant base whatsoever. That's the
Right.
problem I have with those. Tretinoin you can't mix with a moisturizer. Tazarac, for example, is another prescription retinoid that you can, and it doesn't degrade the prescription. If you can get there, in my 20s, I was diehard with that. I mean, my skin was like porcelain. I had no discoloration whatsoever. A derm took me off it because I have rosacea after being on it for 5 years.
Oh, wow.
That was a mistake, a big mistake. But I've never gotten there again because I looked like I was about 40 when I was maybe 25 for about a month. You get dark, you get dry, you get wrinkled, you get... If you're doing a true tretinoin prescription, that's what's going to happen. It's a lot. It's a very big commitment to use a true tretinoin.
And you can't mix tretinoin with another moisturizer and put it on your face.
No, but you can buy ones that are in a more elegant base that don't irritate you. SkinCeuticals is one of them. The Dr. Y is one of them. Those are my 2 favorites. But you want to get something that has a little, a nice, elegant moisture to it.
I tried a sensitive skin retinol serum, and I broke out.
Yeah.
So I guess some skin types are just sensitive to retinoid and can't, I guess.
Does that mean I was
Would that
supposed
go
to
away?
go
Should-
through
should-
it?
should she have gone through it
What
more?
should I have done? Or is that just...
I would probably have to see what you're talking about, but a few pimples here and there, that's going to happen.
It wasn't... It's like I get like in the cheek and chin area, kind of like that lower mouth area, it turned into like kind of hives that would turn into pimples.
Yeah, that's a tricky one. That I don't know.
Right.
I mean, you have to kind of shop around and find the one.
The right one,
Yeah,
right? Okay.
That's probably true.
Okay, so, all right, so that's your daily regimen. Now, outside of that, I mean, obviously you specialize in aesthetic dermatology, right? So I'm just wondering, procedures, right? So I guess, what age were you? First of all, have you done any procedures, right?
Oh, God, yes.
Okay. and I guess, what age did you start? And where do you recommend people start?
So I started, I was probably around 30 when I had Botox for the first time.
Okay.
Maybe 32.
Is that like an
33?
average age?
Millennial market is really different. So that is not the case now.
Right. No. So it's so interesting because I've tried microcurrent and LED, and I actually went to, I think we discussed it on a previous podcast.
Yeah.
I went to
SB Skin.
SB Skin
See, I know
with
where you went.
Shamara, right?
I know where you
went. Because I think we were sharing where we went. I'm not sure. Anyway,
No,
so we went to go see Shamara at SB Skin, and so she was just saying that she was shocked at the amount of 20-something, like 22-year-old girls that were coming in that were getting microcurrent LED and
They're getting it all.
and they had Botox at 22 years old.
That's
That's
I
just-
mean, it's crazy.
I mean, no judgment, but that sounds crazy.
Well, I feel like, do we have long-term studies? Like, are there long-term studies that show what's going to happen if you get Botox for 20 years? I mean, or 30 years at that point, right? Like,
not aesthetically. I mean, I'm sure there are. I would have to look. But, you know, medicinally, it is used and has been used since the 1960s in very high doses for, you know, medical conditions. And nothing, you know, has come out of that in a negative way. So
I'm talking aesthetics. I'm just
yeah,
concerned.
I mean, the muscles will atrophy, no doubt, over time. But I don't think that we've seen anything like that. And
So you recommend people, if you're going to use Botox, you recommend them kind of take a break from it so that their muscles don't atrophy?
I mean, the way I like to educate on that is it is preventative, and that's why a lot of the younger patients are doing it, meaning you don't want to wait for a line to start treating that contraction.
Right.
I treat them with a lower dose, and I treat them a little less frequently than I would somebody who, you know, has had static lines and we're trying to get rid of them. If you don't have any, let's just make sure they don't get there. What I do most often to that age group is other things. So you may have tear troughs. I mean, you know, my daughter has them and she's 6.
Right.
Just the way she's made.
Yeah.
So nose, non-surgical rhinoplasty is a tremendous thing that I do.
And what is that?
You do that?
Yeah.
Well, what is that? What is non-surgical rhinoplasty?
So it's just kind of like doing a nose job for somebody. So you can lift a downturned tip. You can give somebody a bridge. You can get rid of a hump. You can just soften. That's eyes and nose, especially for men. It's a big thing. Chin, very big thing for men.
Right.
So
you do men
sorry.
and women, all age groups. This is amazing.
All age groups.
Okay.
And what product are you using for those different areas?
That really depends. I use a lot of Radiance for those things. I use a lot of hyaluronics for the first time when I'm doing a nose. Nose has a little bit of a tricky blood supply, so you have to be careful with Radiance, especially because it's much thicker. But also, it's so changing to the face. So if it's the first time you're with me,
sounds so scary. It's like a blood supply to the nose, and you.
I'm going to show you.
It's a little thicker. I'm like, what?
I'm going to show you some pictures before I leave today. But it's so changing for the person that I like to do it with hyaluronic acid, just in case they were like, "Wow, you know, I've never had that happen yet." That they're like, "Wow, no, give me back the old one."
Right. But
you don't know.
Right.
So I always say, let's commit with the HA. I can get rid of it if you don't love it, and at least we're in a safe zone. But nose
so
is a
the
big thing.
hyaluronic that only lasts a short period of time. I think what's the
It stays pretty long in the nose because you don't move it all that much.
Right.
But it's a thinner material, so it's not as, you know. It's
Yeah,
not
it's
as
a little
thick,
softer.
It's a little softer.
Okay.
But the longevity is pretty good.
And
9
Radiance,
months.
it lasts a long time.
Yeah, a year probably.
Okay.
Yeah.
Okay. So procedure. So I guess.
Yeah.
Yeah. I'm sorry.
No.
Please.
We were just wondering, kind of, what are you doing the most, and what do you what are you seeing the most results with?
So I love L-therapy.
And L-therapy is what?
L-therapy is sonogram heat. And it's also with a sonogram visualizer, so you can see the depth that you are. So it's guiding you by sonogram visually, and then the heat that you're using to denature the tissue and cause an injury to stimulate collagen is done with sonogram heat. And it targets either 4.5 millimeters, 3 millimeters, or 1.5 millimeters deep. So depending on what we're trying to do and what place we are, but also depending on the person's tissue quality and age. So I could have somebody that's presenting at 4.5 in the cheek, and you know, somebody else may present at 3 in the cheek. So it's important that you have that because not everybody's the same.
Okay.
And then you can tailor the treatment to the patient.
And it thickens the skin. What does it actually do to the skin? Does it firm it?
It tightens it and kind of lifts, because the area that we're trying to target is the connective tissue between the connective tissue and fascia. So it does have a lifting quality.
I see.
And it takes a long time.
Do you have your L-therapy right now?
I have my L-therapy all the time.
And it looks amazing.
Thank you.
Wait, how often do you do L-therapy? Because I feel like I've read that L-therapy is like a 2 to 3 year event, but like how often do you do it?
I like once a year. So spring is my time for that, for whatever reason. But I do it once a year. This is only my second year, but I think it's a great thing.
No, it looks great.
Yeah.
Thank you.
So what else do you recommend? So, I mean, obviously you do everything. You do eye, you do full face.
I do full
Do you do
face.
body as well?
I don't do body.
You don't do body.
I don't do body.
Will you ever get into body, or are you just not interested?
Yeah.
You want to?
I do. I think it's sculpture time. I think it's butt time.
Okay.
I think it's also all therapy for the knees and the elbows and
So although you can do it everywhere.
yeah.
But
Yeah.
I have some
Chest.
knees that I have.
I've done my chest.
You've done décolleté with all therapy?
Yeah, it's wicked, painful,
Oh,
but
really?
it's very, very effective. But I think it's definitely time for that, and also Kybella on the body.
And what's Kybella?
Kybella was FDA approved for submental, which is double chin fat. So you can really, really help somebody on profile that have a little bit of fat there. Not everybody's a candidate. You can't have too much laxity. It can't be too loose, the skin. But you can definitely get rid of fat. So we use it for back fat, bra fat areas,
Oh, amazing.
dimples in the butt. More so than that, we use Sculptra.
That sounds amazing.
Yeah.
The post-baby back fat.
Right.
Yeah. Right. I'm 6 years post.
I know, but it's still there. I mean, I'm 5, but it's still there. I still don't want it.
Oh, God. Okay. All right.
That's amazing.
Yeah.
I didn't know. Is that off market? Is that like
Yes.
not sanctioned kind of thing?
Yeah. It's very off label, but Radiance too, also for dimpling on the butt, the thighs, filling in the kind of.
But the
puckers.
molecules for Radiance are much smaller than, say, Sculptra.
No. Sculptra is powder that's mixed with sterile water. So it's the thinnest that I'm injecting because it's like injecting water. We just flood it. We inject tons of it. When we do a face, for example, the average I inject is 15 cc's. So a syringe, just for the listeners, is 1 cc. So a syringe of Juvederm, let's say, or a syringe of filler. You don't look like that for that long, but for 3 days, you're pretty puffed up. That's to induce a tremendous collagen stimulation. And when you do it on the body, you need a lot of vials. But that's the thinnest.
Is Sculptra what celebrities are doing to their bums? Is that what it is? Is it like Sculptra, or what is it?
doing?
Like, what is going on? What's
is
happening on
going
Fashion Nova?
Right.
Like, I want to know. Fashion Nova is single-handedly ruining my self-esteem.
Where are these bodies coming
where
from?
are they coming?
Nicole?
Like,
I know
what,
we're going left right now, but
I know, but
I'm
I'm
so
like
curious.
We need
as
to
like,
know. We need to understand.
It's a lot of Sculptra.
It's Sculptra.
Yeah. And there's a lot of Radiance too in the butt. But I think Sculptra hit hard maybe like 2 years ago, really hard for the butt. And it's
in
going.
terms of like these tiny waists, right? You see these tiny waists. Is that like just kind of fat transfer? Are they like taking the fat from their waist and then
That was what I
transferring
thought they were doing.
Yeah, I don't know that a lot of what we're seeing is capable just from liposuction and replacing it. I think there's a little bit more to it than that. Like when you have a tummy tuck and they tighten everything and I don't think it's just fat repositioning.
Right. So they're definitely getting some aids.
They're definitely having some help with some things.
Right.
Yeah.
Okay. Because like we call them superheroes when you see these girls and you're just like, wow, look, I saw 3 superheroes in the Superman.
Oh my God, I love that. I'm going to take that.
No,
I'm using that.
like, you see these bodies and you're like, dude, like,
You're like,
who
that's
was
not
built that way?
genetically possible.
No,
it's
it's
like
like
absurd.
impossible. They're superheroes. They're literally
Yeah.
shaped the way
Yeah.
like.
It's like a Barbie doll to a
Yeah,
degree with a big
basically.
butt.
No,
Yeah.
there are so many superheroes in Bergen County, New Jersey. I can't even tell you.
I'm so happy I stay in Brooklyn. There's not many.
No,
that I
it's
see.
not. It's not so much.
No, they're
Yeah.
all in Bergen.
No.
Wow, you got to come to
So,
Brooklyn.
I know.
Yeah.
I know.
Come,
well,
please.
I'm clearly not affected by it because you see, I have no superhero qualities over here.
That's a lie.
But
That
it's
is
all good.
so
It's
a
all
lie.
good.
I know.
It's all good. Listen,
okay.
I'm okay. I'm cool. I'm cool with what I have. So, I mean, we could probably just go on and on. I mean, I think this was a lot, and I would love to have you back if you're open.
Fabulous. This was
I
fun.
mean, this was great. But, I mean, where can we find you?
Yeah.
So I practice at 3 locations. All of that can be found at glowtoxnyc.com.
Okay. And we'll put all this on our social, Radiance and Rosé,
Yeah.
on
Wonderful.
IG. And we'll share everything, and also any pictures you want to show in terms of the work that you've done on noses. I haven't actually seen any of your nose
neither
work.
have I. I'd love to see that.
To show you. And you do noses. You do everything.
I do. There's nothing on the face that I don't do.
Okay.
I do anything and everything.
Okay, great. So,
cool.
we will definitely post some amazing
Before and
photos.
afters.
We'll do some.
We love a good before and after. We before and after each other. Just so you guys know, I often get photos after I've done like a nice peel or a facial with like a before and after of myself from Joy.
No, literally.
That says, this is what you look like before. This is how much better you look now.
I am like queen of the side by side.
She's saving all the photos I've sent.
They're in the WhatsApp. And
They're in WhatsApp.
I just go back like to this date, like
she
this
edits
picture,
them together.
and then I'll like put them side by side. Like this is an amazing before after.
It's amazing. So
I gotta show you
anyway.
this one. You gotta see this one.
All right, we're gonna geek out on photos right now,
right
but
now,
we'll let you guys go.
And we'll share.
Yeah, we'll definitely share. Thank you so much for coming
in.
on today, and for you guys for tuning in.
Yeah.
Check us out again on IG, iTunes Podcast, YouTube, and Podbean. Radiance and
Spotify.
Rosé.
Right. Radiance and Rosé. Hit subscribe and leave a review. If you love it, say it. Shout it.
Shout it.
And keep glowing.
Keep glowing.
Thanks for coming, Nicole.
Thank you for having me. I loved it.
Thanks so much.
Thanks for listening. To keep up with new episodes, hit subscribe. For info on products or topics we've discussed, hop on over to our Instagram or Facebook page at Radiance and Rosé.